I had a patient who I saw a few months ago. I think he fell down from a 20-foot trailer, 20-foot high trailer. So he fell down on one side, all the teeth on that side of his mouth. He had some implants as well, all knocked out.
Even the implants.
Even the implants,
Those
they
are in
broke.
the bone.
Yep.
Ow.
So the implant didn't come out, but it broke. So we had to physically go in and remove the implants. So that was full mouth reconstruction.
Welcome, everybody, to the D4A Personal Injury Show. I'm your host, Jean-Paul Anderson, and I'm sitting here next to my co-host.
Hi, guys. I'm Nicole. I wanted to let you know that we have an amazing guest here today at our show. This is Harleen Grewal, the personal injury dentist located in Valencia.
Santa Clarita, actually. But I guess it's kind of the same. I don't know. Is Santa Clarita the same as Valencia?
It's Santa Clarita, subports are Valencia, Saugus, Stevenson Ranch.
There you go.
She takes care of the whole. So everything up
right.
there, you have to see this facility. Oh,
Definitely
my
state
God.
of the art, definitely.
Beautiful on the inside. Like, if I could have my house look like this, I would definitely would. It's very
Absolutely.
nice.
So, Doctor, would you like to introduce yourself?
Yeah, hi guys. My name is Dr. Harleen Grewal, the personal injury dentist.
Perfect.
And my office name is Skyline Smiles. And I'm a trauma specialist, TMJ specialist, also do cosmetics. I'm also a board certified pediatric dentist, so I also see kids. And I just love what I do and giving people their smile back.
Great. Wonderful. Thank you for coming and joining us today.
Really excited to be here. Thank you, JP.
Likewise.
Could you walk us through, I guess, what steps it takes?
Well,
How would you describe it?
I guess, okay, so this is our first time having, obviously, a dentist here, which is amazing. And so can you kind of introduce our audience to what the initial consult due to, some type of personal injury or, a slip and fall or even an assault case? Like what does a dental office do as an initial consult, especially in your office?
Yeah, so, we want to do a full comprehensive evaluation. We want to do a full, oral exam, a full TMJ exam, extraoral, intraoral. We do everything in our office. We even have our own cone beam CT scan. So that gives a 3D image of all the bony structures. And then we take full mouth x-rays. We take a whole 3D panoramic image as well. So, for the legal purposes, at least we can document subjective, what the patient feels, and objective findings, what I can see with their images, their scan, the cone beam CT, because that gives us a lot of evidence, especially because you may not see things that are broken, but you may feel damage in the TMJ area. So that's a very important thing that we don't want to miss, especially in auto accidents that caused by whiplash injuries, as well as slip and falls. So you may not, like I said, there may not be anything broken where you think you need to send the patient to a dentist, but the patient may have headaches. PTSD can also cause grinding of their teeth at night, and that leads to headaches and, soreness and tenderness around that TMJ joint. So for all those reasons, I think it's really important that a dentist should evaluate the patient as well.
Yeah, absolutely.
That's a really good thing to talk about. I know when it came to personal injury, there was TBI. There's always something new that's coming out, different injuries. When it comes to the TMJ, you don't realize when you get into an accident and it's coming, you clamp up. Your whole body clamps up, your jaw, everything. And then, like you were saying, you're experiencing headaches, but nothing's showing up in MRIs. Your neck seems like it's okay.
Stiff,
It's stiff, but you're still having headaches or,
or jaw
pressure.
pain or, I mean, I'm sure it's
Just tightness.
yeah.
You can't chew properly, or just when you yawn.
Or you hear clicks, right? Like in your jaw.
Clicking and popping, that's a really common symptom as well. So when I realized it, it's funny because my husband's a neurologist. So we share common patients, even in my regular dental practice, not only personal injury.
Nice.
So a lot of them see him for migraines. And so he'll do Botox on their, temporalis muscle that's right there. And then they started coming to see me as a regular dentist. And I said, and I'm evaluating them just like my normal process. And I said, do you get any soreness, tenderness, headaches? And they said, yes. And I said, well, let's do a TMJ protocol for you. So the TMJ protocol usually is we do a steroid injection right here at the joint, and then I use Botox to, loosen up this masseter muscle.
Right.
And magically, all of their headaches went away.
Wow.
So then I'd go home and I'd discuss with my husband, and he's treating the top part, I'm
Right.
treating the bottom part. So we got to do both.
Yeah, no, that works out.
So they're all like, I feel so much better. I'm not grinding my teeth at night. I'm waking up. My headaches have gone away.
Yeah.
So people who get this procedure and who are kind of afraid of needles, are they like a big needle or is it just like a little Botox needle?
No, so I use all my distraction techniques. So we have TVs up on the ceiling. They get headphones. So everybody's just distracted. We got aromatherapy in the room. So just, catering to all the senses. So they're busy watching the TV, the headphones, they can't hear anything.
Nice.
And then I also use this little vibrating device on the other side when I'm injecting on one side. So I'm using the vibrating device. So they really don't even feel it. They don't even know when I'm done.
Wow.
So yeah, that really helps.
Man, that's great. Bleeding and swelling of the gums, are those indicators of a severe dental injury?
They could be, especially in slip and fall cases. I've seen a couple of them where the biggest one I saw was a woman coming out of the swimming pool at a hotel. The transition from the outside to the inside, they were missing the mats. So, it was such a slippery surface, she fell. And the impact was she fell chin first.
Oh.
So chin first, and then that just slammed up into her upper jaw and teeth and gums. The gums were bleeding. So that was one indicator of, yes, bleeding gums indicated traumatic injury. Also, if you have trauma to the TMJ and you're unable to brush your teeth for a very long time, or let's say you got trauma in your arm or a back injury, and that's leading to, less manual dexterity where you can't really brush properly.
Yeah.
So then over time, you're going to have a lot of buildup and everything, and that's going to lead to bleeding gums. So it doesn't mean it's an acute reason, but it's a chronic thing that develops because you're unable to take care of your teeth like you were before the accident.
Got it. Wow.
Yeah.
How can changes in how our teeth fit together indicate a severe dental problem? I guess that's kind of what she explained, huh?
I guess no, because you can have more dental problems. This is like, I guess, outside personal injury, just in your general dentistry. So say, for instance, when you start getting older and your teeth start to shift, how can this is something you need to control because this could be bad over time. Can you explain, like, when your teeth start to shift, what it can do to the rest of your teeth?
Yeah. So why do teeth shift as we age? It's because we lose bone. So the teeth are anchored with the bone, right? So there's a tooth, there's bone, and then there's ligaments between the tooth and the bone that keep it together. So as we age, and as we don't take care of our teeth, our gums start getting very inflamed, the ligaments start breaking down, and then the teeth start shifting. It's like a tree that doesn't have solid soil.
Right. Right.
So then they start shifting, and the shifting of teeth, one, it's a cosmetic issue. Two, that can lead to malocclusion. So you're not able to bite the right way, and that will cause and lead to TMJ issues.
Oh, wow.
So we got to control both then.
I see.
So how we control the gums from getting bad and controlling the shifting is by doing a deep cleaning every few years and then maintaining that and going to the dentist every 3 months.
So I have a question. I know accidents happen a lot. What are some of the ranges of accidents that happen between car accidents, slip and falls? Like, can you describe some of the injuries that have happened?
Yeah. I mean, we've done everything from broken teeth to TMJ issues to a lot of teeth just falling out. I had a patient who I saw a few months ago. I think he fell down from a 20-foot trailer, 20-foot high trailer. So he fell down on one side, all the teeth on that side of his mouth. He had some implants as well, all knocked out.
Even the implants?
Even the implants. They broke.
In the bone?
Yep. So the implant didn't come out, but it broke. So we had to physically go in and remove the implants. So that was full mouth reconstruction.
Oh, wow.
So, but we got the case finished in about 6 months. That was a big case because when you finish, you got to extract the teeth out. You got to bone graft because in order for the implant to integrate with the bone, you need some bone there. So once you take the tooth and the root out, we got to fill up that space with bone, pack it up, and then you allow your body to heal for 2 to 3 months. But in the meantime, we give them an immediate denture to wear. or even if it's an immediate partial denture. So they go home with something
Some things
Yeah.
they don't.
the same day after the extractions.
Yeah, you have your own like 3D.
Yep. And we have our own 3D printer
Yep.
as well. So we print our own night guards. We print our own dentures.
Cool.
Yep.
Yeah.
So
My question is, I know a lot of people have this question and they've heard rumors. The type of bone that goes in for a bone graft.
Yeah.
What is? I know some have heard from it's from humans and some that it's from cows.
yeah, so there's different kinds. It could be cow bone, it could be pig bone, and it could also be synthetic. So there's certain people that don't want any cadaver bone. So then they'll, we use synthetic bone graft as well. It's not as durable as,
Right.
cadaver bone, which could be from human, it could be from pig or cow. Mainly pig because their structure is very similar. When we practice placing implants,
Mhm.
we actually place them on pig skulls.
Oh wow.
So, because they're very similar to
Sounds
humans.
like fun.
So say for instance, this gentleman that got hurt, and when you do the bone graft, do you put the posts in right away?
No.
Or you
So
wait for the bone
we-
to kind of mesh onto the other bone and form?
Yes, correct. So we need about 2 to 3 months for the bone graft to integrate with the bone. And then we take a CT scan again to make sure everything's good. We take a 3D CT, then we plan the placement of the implant
Got it.
because, there's a lot of nerves and
Mhm.
blood vessels. So we want to avoid those areas because we don't want to give the patient a permanent nerve damage
Yeah.
as well. So, there's a lot of stuff that happens behind the scenes, but I have a full lab. We do our own digital design. And then we also have our implant guides that are placed on top of the jaw. And then the day we place the implants, it's just boom, boom, boom. We just go
Going.
and place the implant. And then you leave the implant in there for a few months again. You want that implant to integrate with the bone. And once it's nicely, solidly healed and secure, and then we load the implant with the tooth.
And what about the upper palate? They do sinus lifts as well.
Yes.
For
Yes.
the bone graft.
Yeah, if needed. Again, the CT scan helps so much because we can clearly identify the difference in length between where the implant's going to finish and where the sinus is. It's very easy to rupture a sinus
Yeah.
when you're doing, maxillary implants.
Got it.
So you got to be very careful, but we are, and that's why we have a full 3-stage planning process, and then we can also do a sinus lift if needed.
So when another injury happens, and say for instance they have to have all their teeth removed, how long is the process to be fitted for a denture, or just even not a permanent denture? I guess we can go through the time process of that, but also of just like the temporary glue in.
Yes.
I know everybody recommends the permanent because you don't have to worry about it falling out, or you see those older women blowing out their birthday candles and they,
Oh wow. I haven't seen that one yet, but
that on
no,
TikTok.
I haven't seen that one yet, but that's interesting.
The old lady, she goes to blow her cake out and the teeth just like go flying.
Oh wow.
So permanent dentures, if you're going to do it.
Yes.
How long does that take? So
The process
bone grafts and everything to make the actual denture.
So
many
the cool
weeks,
thing is we
months?
pre-make that before we extract the teeth.
Oh.
Oh,
So we take an intraoral scan. It's a 3D scan, and I take it to my lab. We remove the teeth on the model after it's printed, and then we design the immediate denture. So we want the patient to come in for their treatment, take the teeth out, and we're sending them home with that immediate denture.
very
That's
cool.
great. Yeah, I think the way you were saying it was like the old way of doing it. I think. I don't know.
We still do it, but, in any case, we want to give the patient back full function and full restoration. So they didn't get into a car accident with a denture. They shouldn't get a denture afterwards. They need something permanent.
Yeah, absolutely.
That's true. I've heard that they're uncomfortable.
Oh yeah.
I think
Very.
imagined.
Yeah.
Having to wear this.
Yeah.
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 So let me just talk about. Okay, so I know you're in Valencia, Santa Clarita. Now, if we have someone coming from maybe Northern California or down south in San Diego, Beverly Hills area, what are some of the procedures you can do same day? So it's like an easy travel and everything is done within the same day. That's one good thing.
Yes.
Then this facility is beautiful. So you're not going to get bored there. It's a very beautiful facility.
Yeah, no, we, I see patients all the way from Oakland, Fresno, Bakersfield, San Diego, Hemet, California. I've seen a lot of patients that come in. I just make it very efficient for them. time-wise, because we want to give them the best treatment in the shortest amount of time possible.
Okay.
So they come in and I'm already pre-prepared. I usually try to get their, old records from their previous dental visit if they've had any recently, just so we can see kind of what we're looking into.
Yeah.
And then I also, talk with the patient, see what's going on. And then me and my team, we already have a plan for them before they get there. So the day they get there, we're going to do the exam, evaluation, and I can get started with treatment that same day.
All right. So I have a big question for you. I know accidents happen quite a bit, and broken jaw. Can you talk about that? How does that happen? And do you have someone in your office that helps you along with reconstruction of a broken jaw?
We absolutely do. So we're a full service dental office. I have an oral surgeon that works with us as well, Dr. Kevin Dorsey, best in the industry. And, we've seen a few patients, yes, with broken jaws. So, it's full surgical procedure. So we have a surgical suite. So, he'll put in the brackets that go meet the jaw, and then you got to put in the bone graft again as well. And then we follow up with the patient.
So are you seeing broken jaws happening more often because of hit and runs on the street, Uber? I know.
Or there's also a lot of new bicycle and motorcyclists. Yeah.
A lot of those. What are those things that people
Scooters. Yes.
I
don't wear
see so many
helmets.
patients that have fallen,
On scooters.
on the scooter, especially at night when they got construction going on and they didn't move those orange signs.
Mm-hmm.
So a lot of patients. The last one I saw, he knocked out 2 top and 2 bottom teeth.
Ugh.
So, but he's really happy.
Yeah.
Oh my God.
So, we ended up placing 2 implants on the top, 2 on the bottom. Currently, he's in immediate partial dentures. So,
Oh, wow.
and he loves them. He actually really likes them.
Good.
He wants to make sure that the final implants are going to match his temporary ones because he loves them so much.
I was just going to ask you that. Like, what happens if, like, you have veneers or something and you knock out 2 or 3 teeth and you have to get new ones and it's not going to match, right?
Yeah. I just recently had, I think last month, an Uber case where she was the passenger in the rear seat. And it was a hit and run. And I think they hit the car on her side and she hit her head, even though it wasn't a major impact. But 2 of her veneers, they just popped off. Because in the end of the day, a veneer is just a chemical bond. It's not like a full crown.
Right.
So it's easier for the veneers to pop off. So we had to go ahead and replace all her veneers because you really can't color match something after many years of wear and tear.
Right.
So
My
but
goodness.
it was a fun case. I actually gave her better veneers than she had before.
Good.
That's awesome.
Fresh whiteys.
Yep.
Yeah.
Well, it's good to know that you do veneers
Yes.
as well.
Yep.
Literally everything. A to Z at your office.
Yeah.
So-
Yep. And we also have a med spa. And we've also been treating patients that have, scars after
Oh, yeah.
a cut in the lip. It was the same patient that we saw that flipped over with the scooter.
Oh, my goodness.
So,
Yeah.
he injured his lip was
Split?
split apart.
Oh, my
So
goodness.
he went to the ER. They did a good job by suturing it, but he was still left with a scar.
Yeah, they just, yeah.
So then my nurse practitioner at the med spa, she ended up doing a few microneedling sessions for him,
Oh, nice. Yeah.
and the scar's gone away.
Gone.
So he's a happy camper.
There you go. Wow. That's actually really cool.
With plastic surgeon, you can
Yep.
you can go to the med spa if you have an NP there. They
Yeah.
can definitely help you with.
And do you normally just like suggest, or not suggest, but like do you ask the patient like, hey, we also have a med spa next door in case, you have a scar or something? I think, yeah, right?
Yeah, usually a lot of attorneys will send us patients too, because they know that we take liens for the med spa as well.
Okay.
I think a few weeks ago we got a patient burnt her hand in the rotisserie chicken aisle.
Oh,
It was a pretty bad burn.
yeah.
So, now we got to take care of the burn, the discoloration. So we got all sorts of treatments that we can take care of and help those patients
That's amazing. I didn't know. Yeah.
restored back to their normal
Yeah.
selves.
Oh, yeah. Yeah, especially after a burn.
Yeah.
Ouch.
Yeah.
Very
Yep.
painful.
Yeah, we know about that. Would you recommend, so after a surgery or after any type of implant, would you recommend like any lifestyle changes, eating changes that you need to kind of go about after a surgery?
No, not really. I mean, during the surgery and the healing process, yes, you want to avoid, hard, sticky, chewy foods. But we want to give the patient the best teeth and the best smiles so
Yeah.
they're able to go back to their daily living functions and don't have to worry about anything.
Mm-hmm.
And then when it comes to, we talked about this earlier, getting older, teeth are starting to get loose. Do you recommend calcium tablets to start taking? Is that going to help the problem?
Or what do you recommend?
Yeah, so that would have helped as the person's bones and teeth were growing. as they're young. But now, usually as we age, the problem isn't really because of the calcium. It's because we're not taking care of the gums. So it causes periodontal disease, and the gums start shifting down, the bone starts coming down, and then the teeth are able to move a lot. So we just got to make sure we're, when we brush, the bristles of the brush really don't reach the sulcus of the gum and the tooth. So getting a deep cleaning every few months from a professional hygienist, that's what's going to help best. Okay. And then, flossing every day and using a water pick. A water pick is something I highly recommend everyone to use.
Yeah. Very cool. I think we have a couple of those.
Squirt gun.
Yeah. Well, yeah, that's our kids.
Little technique sensitive to start. Had to learn how to use it first.
Yeah.
You drowned yourself.
Yeah, it hurt a couple times. What is the best way to contact you?
Email us, hello@personalinjurydentist.com. You can call us at 661-244-4036.
Perfect.
You can text me on my personal cell phone, 213-804-5535. And I'm always happy to answer any questions any time of the day and night. No problem.
And you guys are also open Monday through Friday or
Open Monday
Saturday?
through Friday.
Uh-huh.
But again, I'm happy to see patients over the weekend if it's necessary. And,
Great.
I'm a mom as well, but of course, patients come first. So
Oh, yeah. Wow.
we'll take care of them.
That's amazing. Oh, that's
We'll
great.
make sure to link everything below on this video.
Absolutely.
You can get a hold of Harleen, the personal injury dentist.
Yes.
And everything will be linked below. But thank you so much for watching. Thank you so much for coming on to our show today. And don't forget to like, share, and subscribe.
See you guys on the next one.
Thank you, guys.
Thank you.